We as nurses, we own our profession and it's ours. We need to take control of it because if we don't, someone else will.
I would encourage any nurse, if you're not satisfied with the level of care that's being provided, get involved.
I always tell people that it costs less than a cup of coffee a day, and the benefits are tremendous.
We want to hear your voice because that's how practice change happens.
Hello, everyone, and welcome to the New Jersey Nursing Insights podcast. I'm Sue Weaver, and with me is my co-host, Daria Wazek.
We're your hosts from the New Jersey Collaborating Center for Nursing, and we're excited to get right to it. Today, we're chatting about the value of professional nursing organizations.
That's right, Daria, and I'm very happy to introduce Sara Humeny and Dan Misa. Dan, do you want to start by introducing yourself?
Sure, thanks, Sue. My name is Dan Misa. I live in northern New Jersey, and I work at Atlantic Health Chilton Medical Center. I've been there now for 22 years.
Wow. And how about you, Sara? Can you introduce yourself?
Yeah, sure. I'm Sara Humeny, and I live at the Jersey Shore, only about a mile from the beach. I love it that way. And I work at Hackensack Meridian Health. I've been a nurse there just about 20 years, and I'm really excited to be here. Thanks for having me join you.
When someone says they're a member of a professional nursing organization, is it worth the dues? We are going to let you determine that as we chat with our guest. So let's start with you, Dan. What originally drew you into nursing? Tell us a little bit about your career.
Sure. I believe it first started when back in high school, trying to figure out what I want to do with my life, what to go to school for. And initially, I was considering going to become a physician, and it came from the show ER, actually. And I was fascinated by the fast pace, so I figured, all right, maybe we'll try that. So to try to get into that and to prepare for that, I volunteered at Atlantic Health Chilton Medical Center, at the time Chilton Memorial Hospital, and I was on a medical surgical unit, and I got to observe the nursing staff and what they were doing, and I noticed that it was really the nurses that were really at the bedside more often than the physicians. So that kind of swayed me to thinking about going to nursing, but also it kind of helped that my mom's a nurse, and I have other family members who are nurses. So I figured, all right, let's try the nursing thing out, and then that brought me over to go into nursing school, and I got into a few schools. I was staying local in New Jersey, and I pretty much got a full ride to one school, and a colleague who is a pharmacist at Chilton. I used to work in the kitchen there, and after school, and he would come up and he would say, how's things going? How's school? And I told him, oh yeah, I got accepted into school here. And it's like, and then I also told him that on the side, I also got accepted to Rutgers. And he's like, no, go to Rutgers. He's a Rutgers alum, and that swayed me to go to Rutgers, and the rest is history, going to nursing school.
So after you finished nursing school, what were your next steps? What did you do first?
So during nursing school, I was at Chilton all along, getting experience, getting exposed to the profession, to the healthcare arena. And freshman year, it was our trends class, nursing trends class. It was the spring semester. And I remember that one of the upperclassmen was outside the door trying to recruit people to run for our student government association. So I was all right, well, let's give it a try. I put my name down, and then next thing you know, I got elected to our class office, and that really propelled me to get involved into these organizations, whether it's student government. My first professional nursing organization was the nursing student organization, the National Student Nurses Association, and that really paved the way to all the other organizations that I'm involved in now.
Wow. I didn't realize that you were active with the Student Nurses Association. I thought NJSNA was your first organization. So maybe tell everyone about your involvement with NJSNA.
Sure. So the New Jersey State Nurses Association, I was recruited directly from our nursing faculty for that same course, Dr. Lucille Jewell, past president of the American Nurse Association. At the time, my colleagues, my peers, and I, I don't think we really realized the powerhouse that we had as our faculty members, Dr. Lucille Jewell. Like, oh, another faculty member. But along the way, I realized, like, oh my goodness, we have a past ANA president as our faculty member, and she was the one who stressed, join your professional organization. They're the one that advocates for the profession, your specialty, nurses all along. So that really was the big push to get involved to NJSNA and to join. So as soon as I became a registered nurse, I got my license, went online, paid my dues, became a card-carrying NJSNA American Nurse Association member.
Yes, Dr. Joel can be very inspiring, yet down to earth, and really can informally encourage you to belong. So tell us more about your first involvement with NJSNA. Now that you're a card-carrying member, what happened next?
So I went to my very first meeting, and it was in the fall, I think. It was winter time, and I get the monthly or the quarterly newsletter. So I was reading it, and I saw our local region, Region 1, that's Northwest Jersey, Morris, Sussex, Passaic, Warren counties. And we were having a local meeting. It was at St. Clair's, Dover, I believe. And they were having a educational session about orthopedic nursing, from what I can recall. So I said, all right, show up. They had food too. Everyone likes a free meal. It was like a dinner, evening event. So I went, arrived, said hello, and sat down for the meeting, checked it out, got the education, got some food, and that was kind of it initially. It was like, all right, I got my stuff. I kind of said hello to everyone and left. But then, they had more meetings that came along. So, all right, let me keep coming back, see what happens. And then they started noticing, like, who's this guy coming into these meetings? And, like, let's talk a little bit more. Let's get a little more engaged. Got involved in the business aspect of the region meeting. And next thing you know, I become the secretary of the region. And I started helping them out in that regard for their business aspect of the region. And at the time, I believe it was Jackie Galante who was the president for Region 1. And it was a transition point, I believe, for the region with engagement, getting people to come out to the meetings. And Jackie saw the potential in me in what I can do to help our region. So one day we were asked to speak at a colleague's undergrad nursing class. So we went to talk about NJSNA. And right before that, we were in the car together, I believe. She picked me up, we carpooled, and she mentioned, hey, what do you think about becoming president-elect for Region 1? And I was like, I thought about it for a little bit at that moment. I don't think I said yes right away. But I said, let me think about it. We did our thing. We did our presentation for the underclassmen. We had lunch with our colleague, Claire Donahue, who has passed away recently. But after that, I thought about it maybe a few days, and I got back to her. I said, all right, sure, I'll do it. And then I became president-elect. It was like a year in that role because there was no one in that role at the time. And then I became the president of the region.
And a great president of the region you were.
Thanks.
So what benefits did you get from joining NJSNA and becoming president? What happened?
My personal benefits from being a member and getting involved is the leadership skills that I've gained and other nursing life skills. I was on the route and the track of leadership and management because as I became a nurse, so I started clinically in an emergency department. And then I was thinking, so what's next? What's going to be next for me? And I believe at that point, I was like, well, let's think about leadership. Let's think about management, becoming a nurse leader. So this was a way to help me get those skills to become a leader. And at that point, the networking also definitely was a big benefit of it. Getting to make those connections with colleagues and peers in the profession and helping me gain those valuable skills and opportunities that are available to me in terms of career-wise and positions and jobs.
Well, I'm glad you joined NJSNA because I had the opportunity to get to know you and see your amazing leadership of the region. So thank you, Dan.
Thanks.
Now, Sara, tell us about your journey in becoming a nurse.
Yeah, so I was hit by a car when I was 4 years old. And believe it or not, I was actually hit on Nurses Day. So May 6th, 1990, I was hit right out in front of my house, and I spent a month in the hospital. I was in skeletal traction, so I had a compound fracture of my femur. After that, I spent 10 weeks in a full body cast, spica cast from my armpits all the way down to my toes. And that experience, I think, really shaped who I became as a human being, but also, really shaped my career. So during that time when I was in the hospital, I really came to know my nurses, right? I relied on them for everything. So growing up, I kind of thought that I would become a physician. I thought that was something that I wanted to do, but then I realized that the nurses were the ones who really made a bigger impact on my life. I thought I would be a teacher during the school year and a doctor during the summer. And when I joined Medical Explorers when I was in high school, a nurse came in and said, nurses are like teachers and doctors. So that was really my kind of aha moment. I have an aunt who's a nurse and my grandmother who's a nurse. So like Dan, I had family members who really shaped my impact in nursing. So that's kind of how I, found nursing. And for me, I felt like it was really a calling. I went to nursing school right out of high school. I was originally an associate degree nurse. So I went to Ocean County College, and that's how I started out my career.
Oh, great. And what did you do? What was your first job?
Yeah, so I started at Jersey Shore. I was originally hired into the critical care internship program that they had at the time. So I spent a few months training on a med-surg unit. And then very quickly, within about 3 months or so, I was hired to the pediatric ICU. So it was a little bit of a full circle moment for me, because there I was, 20-something years before that I was lying in the bed. So I spent a few years there, and that's when I felt like I needed a change. And then I went to open heart ICU. So I went to adult open heart ICU after about 5 or 6 years in the pediatric ICU.
Oh, okay. Thanks
Yeah.
for sharing. And I guess in the peds ICU, you didn't see any full body casts anymore, right?
Well, care was very different.
Yeah.
So if someone had a compound fracture, they usually put a rod in them and sent them out the next day. So no skeletal traction or things like that. Care is very different, than it was in the 90s, early 90s.
Yeah, that was quite an experience you had as a child, right?
Yeah,
Wow.
for sure.
So tell us how you became involved in a nursing professional organization.
Sure. So I was originally a member of the Critical Care Association. So like Dan, I think when I was in school, I recall them speaking very highly of joining your professional organization and being a member of ANA. And that was sort of a blip, probably in a class at some point. And I felt like when I was in critical care, it was important for me to get the journals and kind of stay abreast on the most important new evidence that was coming out. That's when I joined the Critical Care Association. And I had gone on to one of those conferences and, was really excited about all of the new equipment and all the great networking opportunities and things like that. But there was a colleague of mine who said to me, this was around 2013, who said to me, I, heard of this organization and I think that you'd really enjoy going to their conference, told me about it. And that organization was the American Holistic Nurses Association. At the time, I had never heard of it before. I looked up the conference and I pretty much just signed up, got in the car a couple weeks later, drove down. I didn't know anyone, didn't really know much about the organization. I was a newly single mom, so I was newly divorced. At the time, I was feeling pretty burnt out in the pediatric ICU. And I just pretty much got in the car and went. And so I think that was pretty gutsy. But when I look back at that, that was something that was calling me to that. And I can still recall when I close my eyes, that moment of being in that very first class at that conference when I was surrounded by nurses that had a very similar way of practicing. So in the American Holistic Nurse Association, we look at, taking care of the whole person, mind, body, and spirit. And so that was really the way I was raised. So while I had a really early experience with the healthcare system, being hit by a car, my mom was a massage therapist. So when I had a headache when I was a kid, she would give me lavender essential oils, tell me to rub it on my temple and lay down and rest, not give me a Tylenol and tell me to get back out there and push on through. So while I really respect and know, working in the acute care setting, the importance of modern medicine, I recognize that there is a whole list of things that we can be doing to really care for the whole person. And so getting involved with the American Holistic Nurses Association, I've really been able to connect with people that are caring and promoting this way of care for people. So I really found, I kind of say like my tribe when I went to that conference. And so the rest is really kind of history in that way.
Wow, that's really cool that you took that leap and went to that conference like that. So Dan talked about how he was inspired, particularly by Lucille Joel. Was there any inspiring moments that you can share?
Yeah. So actually, when I went to that conference, Sue, there was one person, again, I didn't know anyone. I was a newer nurse. I was young. I didn't know anyone. And when I was sitting at lunch, one of the very first days of the conference, I just started talking to someone and kind of sharing my story. And I didn't know it at the time, but the person I was sitting next to was named Barbara Dossi. She was one of the founders of that organization, the American Holistic Nurses Association. She's written some of the textbooks on holistic nursing and came to find out later who she was. I was kind of just spilling, my career and some of my personal, struggles at the time. But she looked at me and she said, "You're going to be the president of this organization one day." And I think she kind of planted a seed in me. I didn't know it at the time what that meant because I didn't really know a lot about the organization. But I came to find that I needed sort of that community of people back home in New Jersey, right? And when I came home to New Jersey, I was able to kind of network and find more nurses that sort of had a very similar way of caring and providing that care for their patients. So I had stayed connected with Barbara Dossi, and there have been many people along the way, I think, that have really inspired me to step into those positions of leadership. And, to Dan's point, I think it's been people that have given me the invitation. So I think when you don't always have the courage, to step into those positions of leadership, it's the people along the way that maybe see something in you that you don't see in yourself.
Wow, that's pretty amazing that she said that to you. Do you remember what was your initial reaction when she said it to you?
Yeah. I was like, who am I? Right? Like, again, I was sort of that young nurse. I think at the time I only had maybe 6 years of experience and I didn't know that much about the organization. So once I came to learn more about the association, came to practice more clinically, did a lot of my own self-reflection, then I think I came to really believe, okay, maybe this is something that's possible. Even still, when our president at the time of the American Holistic Nurse Association said, we're looking for someone to, step into this president-elect position, I still had to pause and consult with a few people and say, am I really ready? I think having those support people around you is so important because sometimes they have to sort of remind you of who you are and what you're capable of.
Great. And maybe we should tell our listeners that you're currently president-elect of the American Holistic Nurses Association. When do you start as president?
Yeah, so I will take the president role in June of 2027. So the president-elect position is 2 years, and then I'll step into president in June of 2027, which is a 2-year position.
Great. And Dan, other than NJSNA, is there another nursing organization you are particularly proud of being a member?
Sure. I'm actually a lifetime member of the Emergency Nurses Association. I'm the current president-elect for New Jersey. So this year is my term, is my position there, and then next year is a one-year term as the president for the state. So that's after ANA and NGSNA. That's also high up on my list for nursing organizations. Joined as a lifetime member right after getting my RN license, and at the time, you were able to pay into becoming a lifetime member, and it has tremendously paid off since then. But now they changed it a little bit. You have to be a member for 20 years to become a lifetime member.
Yeah, that's what I'm familiar with. Lifetime member, you're a member a long time. I'm like, you're not old enough to be a lifetime member.
No, not at that time. No, I was a young 20-something.
To switch gears a little bit, I'd like to put this out there. I feel like there are some nurses who go through their careers not joining a single professional nursing organization, and they may even say, it's a waste of money. I'm just paying dues. I never hear from this organization. What would you say to that? What are they missing if they're not in a professional nursing organization?
I would tell them that it is their responsibility and obligation to the profession. We as nurses, we own our profession and it's ours. We need to take control of it, because if we don't, someone else will. So we need to get involved. We need to join. I always tell people that it's costs less than a cup of coffee a day, if you think about it. And in the end, the benefits are tremendous, directly and indirectly. They advocate for you in different legislative perspectives at the state, local, and national levels. And there's also the other benefits of education and networking, of course.
Yeah, and I'll add to that. I think that we get out of it what we put in. So it comes directly from our scopes and standards of holistic nursing. And I'm going to paraphrase. Jean Watson says something like, we have a covenant with the public to sustain caring, and it's our professional obligation to do so. So, no one is going to stand up for caring if we don't do it. So to Dan's point, if nurses don't do it, who's going to do it? It's not going to be truck drivers that say we need to care for people. It's not going to be accountants that say who's going to care for us. It's the nurses that are going to stand up for that. So, each professional association has a little bit of a different lens on that way of caring. So if you are an oncology nurse or you're a critical care nurse, you're the specialist in that on the front line. So I would encourage any nurse, if you're not satisfied with the level of care that's being provided, get involved, right? We encourage our members to get involved. We want to hear your voice, because that's how practice change happens. That's how evidence-based care gets implemented, by people getting involved.
And I just have to add to this conversation too. I remember being in the ICU and being a member of New Jersey State Nurses Association. It just opened my eyes to the world of nursing. Like, I knew my ICU and the care I needed to give, but it opened up ideas like human trafficking. I'm like, what does human trafficking have to do with me as a nurse? And then policy and advocacy. So I think just broadening your perspective on nursing is the big benefit that I found with professional organizations.
Well, I have a similar story. I was at one point an occupational health nurse, and I joined the local chapter of the Occupational Health Nurses Association, which was in Los Angeles at the time. And I was connected with so many other occupational health nurses in areas I never imagined. Like, one worked at Universal Studios, one at ABC, and pretty much any organization can have an occupational health nurse. So that was really eye-opening for me. And also that networking, because it is an independent role and you may not have another nurse to tap their shoulder and ask a question. So it was a great way to network and to create that community. And you've given examples like that as well. What are some other advantages to being in a professional organization that you've taken advantage of? For example, continuing education or journals or professional development. Have you utilized those benefits as well?
Yes, there's multiple different journals that come with the benefits of being a member of a nursing organization, and conferences are huge for me. I've been to the annual Emergency Nurses Association conference every year since my first conference in San Diego. This is now going back a little over 10 years ago now. And these conferences, it's a gathering of like-minded people, emergency nurses for this group, right? And the same energy, the same interests, and it really reminds you that you're not alone. What happens here in Jersey similarly happens across the country, if not around the world.
Mm-hmm.
And we face the same challenges, and we share the same stories. And we can share in that and kind of commiserate, but we also celebrate our wins and our opportunities that we encounter. And I always leave there with my cup feeling refilled, and I can keep going and continue with what I do on a day-to-day.
Yeah, and I'll add to that. I think the conferences for any association is a great opportunity for networking. So, to be able to meet people in all different parts of the country, or in some cases in parts of the world where people are facing similar challenges, but also opportunities to be creative, right? So you're hearing about ways that people are practicing, thinking outside of the box. Or for me, going to that very first conference for the American Holistic Nurses Association, I was hearing about hospitals or systems where they were implementing well-being programs. And at the time, this was like cutting edge. And I was like, how do I bring this back to the health system that I work in? How can we start to do those types of things? So beginning to network with those people, I think gave me excitement in what I was doing every day in my career. So it like reinvigorated me. So instead of, and I'll give you an example, I was approached by my educator to measure ventilator times. And while that's really important as a bedside nurse, I know that's important. I was like, here's what I'm seeing. I'm seeing that many of the nurses in my unit are experiencing burnout, and nobody's doing anything about it. I think that we need to address this issue. And my educator was like, well, instead of measuring ventilator times, do you want to work together to put on a conference here at our hospital for self-care for nurses? And I said, I would love that, but how do I do it? She's like, well, we're going to figure it out. Let's get speakers, and then we'll get contact hours for it. So she supported me to do it. I was a bedside nurse, but with the support of that educator, that team, it was successful. So it reinvigorated my interest at the bedside. So even though I was still showing up, doing the work, caring for those critical care patients, it gave me a whole different lens on the care that I was providing for them. So I think that was a new way of looking at things. It wasn't like where I was feeling depleted sometimes in the redundancy of, okay, what am I doing in this day to day? It gave me something like to look forward to.
Great. And all these conferences can also give you an opportunity to see new places, travel. I recall at one point I was going to certain conferences every year, and I was collecting a little pin. I had this whole collection. Were you finding any particular benefits with that, or racking up some frequent flyer miles or anything?
Oh yeah, I love traveling. I love traveling. I love seeing the places. The one joke was, where in the world is Dan? Like, where is he? Like, during the pandemic, we were having our virtual meetings. I'm a member of the ONLNJ, the Organization of Nurse Leaders New Jersey, and just recently, maybe like last week or something, a fellow committee member, I bumped into her. Her name is Tia, and she reminded me, like, hey, where are you now? What are you doing? Where are you going next week? I do it for travel, for fun, for nursing related stuff, but even for the nursing for international, for the Emergency Nurse Association, I've participated in 2 international exchanges. There was an opportunity in Russia. I went to Russia, and right after Superstorm Sandy had hit, I remember I was packing with no power. The timing was just happened to be. And I packed, went over there. It was cold over there. It was November also. I remember standing in Red Square. My legs were like freezing. And at the time, the delegation leader, her name was Anne-Marie Papa. She's from Pennsylvania, leader in emergency nursing in her own right. And more recently, I went to Madrid, Spain. Same thing with the ENA and the International Exchange, Global Exchange, and got to also learn about the healthcare system there, emergency care, emergency nursing. And it's amazing the similarities and also the differences in how it's being done overseas. That delegation leader, her name is she's from West Virginia, Chris Dellinger, and yeah, she's awesome. They're all very nice and kind, and they're leaders in and of itself.
And so I think, I have a really big family. So my mom is one of 8 kids. So once everyone got married and then had their own children, we're sort of spread all over the United States. So I love the opportunity to not only travel to the conferences, but if I can tack on like seeing a family member also, that makes it that much better. So last year, I was able to go visit Chicago. So in addition to being on the board for the American Holistic Nurses Association, as part of that responsibility, I'm also on the Nurses on Boards Coalition. So their meeting was at the Emergency Nurses Association headquarters, which is over in Schaumburg, which is right outside of Chicago. So I was able to also visit my cousin and his wife who live right in Chicago. So that was really fun for me. And Dan, what was really cool is I got to see at their headquarters the very first code card, which I hear that they bring to some of their conferences. So again, what was cool about that is creativity, right? You get to really see what were these people thinking when they came up with this first code card, and great networking opportunity. Another thing, what happened last year when I traveled out to Reno for our American Holistic Nurses Association conference, I was able to sit with our international chapter leaders. So we had people from Japan and Italy, and we had a little sit down. And so everyone was translating and we were sort of sharing ideas and things like that. So I didn't get to travel internationally. It was really interesting to watch everyone sharing the different ideas from the international chapters. So I loved being a part of that.
Yeah, Sarah, I was at the headquarters of ENA in Schaumburg, and I have quite a few pictures of that first code card, and it's amazing how the history and the story of that, how for the emergency nurses, 2 nurses, one from California and one from New York, and they somehow connected and collaborated and formed the organization to what it is today. It's amazing.
Wow. And how did they connect? There was no internet probably when they were connecting. It was probably by mail, right?
Yeah, and it was the association was formed in 1970, and I guess people talk, people travel, and then hey, this nurse over in New York, Anita Dorr, she's doing something. And Judy Keller in California, like, oh, all right, so let's see what we can do. They got on the phone, maybe their rotary phone in the kitchen with the long cord, and like, hey, what are you doing
Yes,
over there?
that's right.
So,
Yeah.
and here it is. It's amazing. It's quite the history.
Yeah.
I like that stuff, that history of how we got here today with our profession.
Yeah, me too. And I like to talk to student nurses periodically to their class to inspire them to join professional organizations. And I share with them the Emergency Nurses Association. They were the ones who did the research and saw the importance of family presence at the bedside during codes. I think that was amazing, and how important it is for families, especially in the emergency room, to be shush, no, you can't come in, but to allow them, if they're able to come in. And then our critical care nurses, AACN, that they developed 20 years ago, those standards for the healthy work environment. To have that vision, and those standards are so important today. We know in the standards, staffing is one of the 6 standards, but there are other, like effective decision-making, true collaboration. All of those standards are important. So, Sarah, you can talk about, I know you've done some work helping advance the profession. Can you talk about about what you did in New Jersey to advance the profession?
Oh, you're probably talking about that position statement, aren't you, Sue?
Yes.
Well, like anything else, when when you're doing anything to advance, or make change, it's not easy, or it doesn't happen quickly. So the position statement for what we did here for holistic nursing took about 2 years of work with a team. It took a whole team. And like I said, it wasn't easy. I think we did it because we knew it needed to be done. Here in New Jersey, we didn't have language around self-care as a prerequisite for providing high-quality, safe patient care. And so we saw an opportunity for that, but also around education for, holistic care for our patients. So we worked together and we wrote the position statement. So it was something exciting to be a part of. And, I'm glad that we had your help, Sue, because you were definitely, a key component to moving that forward.
Well, you and the others were experts in holistic nursing, so we were happy to support you with that. So, but it's great that we have that position statement now available in New Jersey. So I have a question for Dan. How many nursing organizations should I join? What do you recommend? Or maybe I shouldn't even ask you that question.
I mean, if you only have to join one, either it's your clinical specialty or a specialty that you're currently involved in. But every nurse should be a member of the ANA, the American Nurses Association, and along the same lines for New Jersey, right? NGSNA, New Jersey State Nurse Association, because they're the premier. They're the ones that are really advocating for all of nursing. So if you had to pick one, the money is tight, right? Yeah, ANA, NGSNA. If by chance the person was like, well, I'm really close to my specialty, then pick the specialty. So for emergency nurses, the Emergency Nurse Association. But me as a nurse leader and now nursing professional development, I have so many other memberships, right? I'm an ANA and NGSNA member. My clinical specialty is the emergency nurses. I'm a nurse leader, so that's at the national level, it's AONL, but locally that's ONL and J. And then now I pivoted within the last 3 years. I'm the full-time nighttime nurse educator or nursing professional development practitioner or specialist. So that's ANPD. That's their association, the Association for Nursing Professional Development. So there's so many out there. And there's also cultural ones out there too. For the men in nursing, there's American Association for Men in Nursing. I'm a member of that one. And culturally, my heritage, I'm Filipino, so I'm a Philippine Nurses Association of America member. So it's a lot of cards, there's a lot of dues that come through, but I kind of just write it off in the end. But I enjoy the connection. I enjoy interacting with people. So that's what I get out of it. And I have no regrets for any of that at all.
Yes, I like seeing you at all these different conferences, Dan. Where's Dan now? And you're an expert in Robert's Rules, aren't you?
Oh, yes. Parliamentary authority. My very first NGSNA convention in Atlantic City, we were at the business meeting, and I believe I was the president-elect or the president of our region, Region 1, and they were doing bylaws. If everyone knows bylaws, it's a lot of wordsmithing and this and that, and the discussion was going on, and at the point, I was like, I got up to the microphone, I was like, I called the question, which means, stop debate, end the debate, let's move on. And everyone's like, yeah, good job, Dan. So I was glad to be that person to help move things along a little bit there.
Yeah, I remember that. I was glad you did that too. I was glad. So, Sara, what are your recommendations regarding how many should we join? Which one should we join? How do I decide?
Yeah, I think that's a great question. I would recommend joining the ANA and JSNA if you can afford to do so. Become a member of your specialty. If you have multiple specialties, you're going to want to look at what the membership offers, right? So different memberships, different associations are going to offer different benefits. So really kind of look around and see what the different associations offer. I think to do your homework a little bit before you go and just spend your money. It can get costly, like Dan said, but you're going to want to take a look and see what you're going to get out of it. So, we just want to be obviously cautious about what we're spending our money on for most of us, because there is a value proposition that comes with it. So that is something that I know, for our association, that's something that we're always talking about. What are our members getting out of our membership? How are we making sure that we're providing that value for them? So doing their homework and looking around and seeing what the best fit is for them. Again, for me, as soon as I got to that conference, I knew where was going to be the best fit.
That's great. And how has being a member of a professional organization influenced you today? What has been the impact on your career?
The impact becoming involved in a professional organization, it can be life-changing. I can recall my membership as a member of NGSNA and the ANA. I went to this neighbor, Region 2, they're Bergen and Hudson County. So they had an event for Nurses Week. It was a free dinner. It was a very nice dinner, very nice restaurant. I can't remember the speaker at the time, but I went. It was Nurses Week. Why not? It was a great event. And I bumped into Lucille Joel again because that's her region. She's from Bergen County, Region 2. And I was going back to grad school. I got accepted into this one program. I told her, like, hey, I'm going to go to this program. It wasn't Rutgers at the time. I wasn't choosing Rutgers. And then she heard, no, Rutgers, they have that program, leadership, nursing leadership. You go to Rutgers, I'm going to write your recommendation. So I'm like, okay, thank you. I will go ahead and go back. Why not? And, to think what could have happened if I didn't go back to Rutgers, like what connections, what doors may not have opened. Education is important. Different programs are out there, different opinions. Rutgers, I went to the first time for my undergrad, but to have that voice, that advice, that sage advice, that leadership, that mentorship, I took it. I took it to heart, and I went back, and I got to meet my specialty director, Dr. Egna Cadmus, who was transitioning from the hospital setting from Englewood to Rutgers. So she was also in this pivotal moment. So it was really coming about with that program, and I was involved in that initial stages. And it's great to be under her leadership and vision, and really built me up to where I am here today.
Wow, you had some inspiring leaders impact your career.
Absolutely.
How about you, Sara?
Yeah. So I think when I look back, I've had a lot of full circle moments in my career. And so being a part of the associations is really just recognizing that where I am in my career right now and being a part of those associations has created those like full circle moments. So I just recently was able to go on a trip. I was a nurse planner for a trip to Peru, down in the Amazon rainforest in the jungle, where we studied medicinal plants and we learned alongside indigenous people. So being a part of that with 14 other people, I wouldn't have had that opportunity to do that if I hadn't had gone to that conference, if I hadn't gotten involved, if I hadn't stepped up to be on the board, become that president-elect. It was the president who offered that as an invitation if I wanted to become the nurse planner for that trip. I think like anything, if you say yes, you never know, like Dan says, those doors that will open. And so really, like when I reflect back on my career, what I do every day right now in my role in education at Hackensack Meridian Health, I feel like professionally and personally, I'm living in alignment. And so the people I meet across the country and across the world are just fulfilling my life that much more. And so I feel like when you get involved in a professional association, it just enriches your career that much more.
That's actually a perfect segue to this last question that we ask all of our guests. Sara, you talked about your professional and personal life being in alignment. What do you do for self-care? Can you speak more to that, of how you care for yourself? And then I'll have Dan answer that as well. I mean, you're both very busy with both your work and your professional organizations. How do you balance that and take care of yourself?
Yeah, so for me, it is a regular conversation that I have with myself to be checking in, to set healthy boundaries, because it's not something that I learned in nursing school, and it's not something that I learned growing up. And I think being a woman, it's not something that a woman and a nurse that we're good at naturally to set those healthy boundaries. So self-care for me looks like something simple like going for a walk with my dog, enjoying a cup of coffee on my porch. Really simple little things. In the summer, since I live near the beach, I love to ride my bike up to beach yoga. That is, if I had a perfect day, it would be riding my bike up to beach yoga, coming home and taking an outdoor shower. So really being connected with nature, but I don't always have that much time. So it could be something simple like just taking a few deep breaths and having 5 minutes to myself. So I think self-care is something that I have to do on a regular basis, not just going on vacation once a year.
For me, for self-care and what I do for myself, so I did travel nursing for a few years initially during the pandemic, but all along I was always working at Atlantic Health Chilton. I was per diem at one point, came back full-time 3 years ago, but my friend, former roommate, she introduced me to this spa that she would go to in Ridgewood. So I got connected, and now I have a membership for their like a yearly massage membership. So I would go there to de-stress and to really support myself, because I work night shift, and that's not always easy on the body. So sometimes that's much needed to really take care of myself in that fashion. But aside from that, a little bit of a stretch with my traveling, as I mentioned before. I love it. I like to see different places. Last few New Year's Eves, I've been to different places, mix it up a little bit. I was in Sydney, Australia this immediate past New Year's Eve, and saw the fireworks over the Sydney Harbor. And it was beautiful, amazing. And trying to figure out what I'm going to do next New Year's Eve, where we're going to go next.
Well, thank you so much, Sara and Dan, for sharing your stories. I know that I am personally inspired. I'm sure there's some nurses out there who are inspired to join a professional nursing organization now. And Dan, I'm going to look out there for your Where's Dan book. I'm going to buy that. Instead of Where's Waldo, Where's Dan? That's going to be a hit. Thank you so much.
Thank you.
Thank you.
Thanks.